Hi, hello everyone, welcome to Dental Hub. Today we are going to discuss about Sjogren's syndrome. Sjogren's syndrome is also known as Sika syndrome. So, Sjogren's syndrome is also be asked as Sika syndrome, and it is a chronic autoimmune disorder causing a triad of symptoms. The first is keratoconjunctivitis sicca. It's also known as xerophthalmia. It is mainly presented as dry eyes. And the second symptom is xerostomia, it is dry mouth due to decrease in salivation. The third symptom is arthritis, which is joint inflammation. The Sjogren's syndrome is more common in females than in males, with the average of 40 to 60 years. And it is caused by lymphocytic infiltration of salivary and lacrimal glands. So the salivary and the lacrimal glands are mainly affected due to lymphocytic infiltration. The Sjogren's syndrome is generally two main types: primary Sjogren's syndrome and secondary Sjogren's syndrome. Primary Sjogren's syndrome is also known as Sicca complex. When the patient present with only dry eyes and dry mouth, then it is primary Sjogren's syndrome. In this primary Sjogren's syndrome, there is no other systemic complication, only the patient present with dry eyes and the dry mouth. In secondary Sjogren's syndrome, along with the primary symptoms, we can see rheumatoid arthritis, lupus erythematosus, and polymyositis. And we can also see secondary Sjogren's syndrome in case of HIV. So, the primary Sjogren's syndrome, there is no other systemic complications other than dry eyes and dry mouth. In case of secondary Sjogren's syndrome, along with the primary symptoms, rheumatoid arthritis, lupus erythematosus, and the polymyositis and HIV are seen. The histological features of the Sjogren's syndrome are there are three types of histological patterns are seen. There are mainly three types of histological patterns are seen in the histological sections of the Sjogren's syndrome. One is intense lymphocytic infiltration of gland replacing the acinic structures. So the salivary gland is infiltrated with the lymphocytic structures, replacing the acinic structures. Here we can see these are acinic cells. These are all acinic cells. And this is lymphocytic infiltration. These are acinic cells. These are replaced by lymphocytic infiltration. And we can also see atrophy of the glands. Atrophy of the salivary glands is mainly seen, and there is proliferation of ductal and myoepitheliums forming epimyoepithelial islands. So there is proliferation in the ductal and myoepitheliums forming epimyoepithelial islands. The treatment of Sjogren's syndrome is there is no cure for the Sjogren's syndrome. There is only symptomatic relief. For the dry eyes, artificial tears is the treatment. And for dry mouth, we can stimulate the salivation by using the drug pilocarpine. And hydration, antifungals for oral candidiasis. So candidiasis mainly occurs when there is dry mouth, no? So for the oral candidiasis, antifungals are used like clotrimazole, and oral hygiene instructions are given. So dental caries can occur due to dry mouth, so oral hygiene instructions are given. For the systemic complication, hydroxychloroquine is generally given. Thank you.